Welcome, everybody. I believe we're starting to have people arriving at this meeting. My name's Hugh Salmon from the Global Social Service Workforce Alliance, and I'm going to be opening the webinar, which is on bringing lived experience voices to the social service workforce in Uganda. So we'll just give a few more minutes for folks to arrive, and then we'll get started in 2 minutes, if that's okay. I think if the panelists could also have their videos on at the beginning, that will be great. Then everybody can see when I introduce the panelists, then everybody will be able to see you. Okay, welcome everybody. I'm just going to stop my screen share for a moment so that we can all see each other more clearly. I'm delighted to welcome you, everybody, whether it's in your morning, your afternoon, or evening. Welcome. I'm Hugh Salmon, as I said, the director of the Social Service Workforce Alliance, and we're very happy to have you join us today for this webinar, in which we'll showcase the findings and results from the project Strengthening the Social Service Workforce for Family-Based Care in Uganda. And more broadly, we're going to discuss promising efforts to strengthen the social service workforce in Uganda. As we begin, I first want to acknowledge the incredible commitment and dedication of social service professionals around the world. Whether we are social workers, case managers, parasocial workers, or community volunteers, this workforce is essential to strengthening families, protecting children, and fostering community well-being. Social service workers, as I think most of us here today would recognize, are the backbone of efforts to reform care systems, which are all about ensuring that every child grows up in a safe, nurturing, and supportive environment. And the workforce, they are key to achieving lasting family-based care solutions. However, too often, this workforce is understaffed, under-recognized, overworked, and lacking the practical guidance and inspiration needed to effectively support children and families. Whilst many have received formal training, sustained efforts to develop essential competencies, including child and family-centered behaviors, practices, and values, have often been lacking. So we need to build competencies that combine head, which is the things we hold in our head, the technical knowledge. Social service workers also need to have heart, which is their commitment, ethics, and values, and hands, the practical skills and behaviors. So we need to combine knowledge with values and skills, head, heart, and hands. We need to build those competencies. Without ongoing professional development and supervision, newly trained workers will revert to institutional or bureaucratic approaches, which hinder progress to care reform. Now, by institutional approaches, I mean not only children being cared for in institutions, but I mean the way people work. They fall back on a provider-centered or resource-led approach, as opposed to a child-centered and a family-centered approach, which is needs-led, as opposed to just working in a way that's convenient for us, the provider. So we need to be child and family-centered, not provider-centered. So that is the approach needed for care systems to be reformed. More broadly, in recent years, we're very pleased that the government of Uganda has taken great steps to strengthen the capacity of the social service workforce to deliver social care and support services. These efforts have included reviews and assessments of specific aspects of the social protection system, developing standards on social work education, a national child protection curriculum, a competency framework for parasocial workers, and standard operating procedures and tools for case management in child protection and alternative care. And my organization, I'm delighted to say, was involved as the Global Social Service Workforce Alliance with Dr. Janistik Tukerize and Agnes Wasike in partnership with UNICEF, we were supporting the Ministry of Gender in developing a national social service workforce strengthening framework, which I believe is now already in operation and upon which great things will be built. However, despite these ongoing efforts, significant gaps still exist that impede the capacity of the social service workforce to effectively deliver social care and support services. So it's against that background that the Global Social Service Workforce Alliance, in partnership with the Martin James Foundation and the consultancy firm Child Frontiers, began implementing the project Strengthening the Social Service Workforce for Family-Based Care. And we have done so with national partners in Uganda, who will be talking today from Child's Eye Foundation, and also in India and Brazil. So our work in Uganda, which you'll hear about, led by Child's Eye Foundation, has been a 2-year initiative and has learned from and integrated the perspectives, crucially, of care-experienced children, youth, and caregivers. And it has helped incorporate those perspectives into training materials to strengthen, deepen, and sustain the motivation and child and family-centered professional competencies of the social service workforce. In other words, strengthen how they work, using and mobilizing, as I said before, the heart and the hands, as well as the knowledge that goes into the head. So in Uganda, the project commenced with field testing of the tools in May, focusing on vulnerable families, reintegrated children, and care leavers in Mpigi and Kampala. And this was done in collaboration with the Child's Eye team and the Association of Care Leavers of Uganda. Following the field testing, Child's Eye conducted consultations with 133 caregivers and children from vulnerable and reintegrated families, as well as care leavers, and concluded with analysis of findings. Then in the second phase, materials were gathered during consultations to develop training tools, which were tested with 30 social workers from government agencies, NGOs, and community volunteers. Feedback from the trainings then informed the revision of the tools, which will soon be disseminated more broadly. So watch this space. Before we begin, just a few things about today's webinar. So now I will just open up the slides once more. So let's bring it up. So just in brief, these are the organizations that you'll be seeing represented here today, as already mentioned. I'm just trying to find the right point. So we're being co-hosted by Child's Eye Foundation and the Global Social Service Workforce Alliance. In case any of you don't know, and I'm sure many of you do, Child's Eye Foundation is a non-profit organization based in Uganda that works to ensure that every child grows up in a safe and loving family. They focus on family-based care by reuniting children with their biological families, supporting kinship and foster care, and providing community-led solutions to prevent family separation. My organization, the Global Social Service Workforce Alliance, is an inclusive, representative network of members working together to build a world in which a well-planned, developed, and supported social service workforce is better able to address the needs of at-risk individuals and communities. So in Uganda, the project was implemented by Child's Eye Foundation in coordination with the Association of Care Leavers of Uganda, colleagues of whom are present here today as well, and in consultation with the consultants from Child Frontiers. The Association of Care Leavers of Uganda is a network for care-experienced individuals incubated in Child's Eye Foundation, and their input has been so crucial to this project, as you'll soon be hearing. Child Frontiers is a consulting company, and they promote the care and well-being and protection of children worldwide. And of course, we must mention that this project has been graciously funded by the Martin James Foundation, which is a global network of organizations working towards a vision of a world where children can grow up and thrive in safe, loving families. The Martin James Foundation offers a mix of technical support and funding support to community-led organizations working in care reform. So that's the initial introduction and to who's here today. I'm going to introduce the panel in a minute. So this is the agenda. You can see that we're going to have a presentation from Sumaya Nasuna, who is a social worker with Child's Eye Foundation and also representing Uganda Care Leavers Association. Then I'm going to moderate a discussion with two key panelists, Dr. Senkosi Moses, who is the president of the National Association of Social Workers of Uganda, and Dr. Ronald Luangula from Makerere University. And then we'll have closing remarks from David Adoke, the country director of Child's Eye Foundation. Okay, just a few logistics before we get fully started. So as with other webinars, please submit any questions that you have for our speakers and panelists at any time using the Q&A button. However, please feel free to introduce yourself through the chat. So you can use the chat to say hello to everybody, to say who you are and where you're coming from, which organization. We welcome you to do that. But if you have a question for the panelists, please click on the Q&A button, and then we can see it and we can make sure it gets answered. This webinar is being recorded and will be made available via the Global Social Service Workforce Alliance and Child's Eye Foundation websites so that other people can follow it along later. Okay, so thank you once again for being part of this webinar, and we look forward to sharing more about the project. So now I'm delighted to say that I'm going to hand the mic over to Sumaya Nasuna from the Child's Eye Foundation, who will tell us more about this project. Thank you very much. Over to you, Sumaya. I think meanwhile, the other panelists, you can turn your videos off, I think, and we can focus on Sumaya. And if my colleagues could also spotlight, I will do that as well. I'll spotlight you for everyone. Sumaya, great. Please get started.
Thank you so much. Thank you so much, Hugh, and thank you so much, everyone. My name is Sumaya Nasuna. I'm a social worker and also a young person with lived experience of care. It's great to share these findings with you that we conducted in Uganda, specifically in 2 districts, that is Kampala and Mpigi. Thank you so much. I'll go straight forward to the presentation, and it's great to have you. As Hugh has said, the project is looking at strengthening the social service workforce in light with bringing lived experience to the social service workforce, highlighting voices of care experienced youth and children, young adults, caregivers in vulnerable and reintegrated families in Uganda. Thank you. Next, Hugh. What approaches we used in this participatory assessment? We conducted first desk reviews and reception reports of what was existing, highlighting achievements and what has been done so far. Then we also continued with the participatory assessments that included consultations with young people with lived experience of care, family members, that is caregivers and caregivers, both male and female, and children. Thank you so much, Hugh. After the consultations, after collecting the data, this data informed the development of tools, and through insights and creative media from the assessment, we used to develop engaging training tools that are used currently to transform the knowledge, attitudes, and practices of social service workers so that they are motivated, skilled, and they are prioritizing family-based care over institutional care. Then we followed with development of advocacy tools, of course, reflecting from the findings from the consultations, and also the development of tools with social workers and community volunteers. We had to get advocacy asks that were informed by these particular findings. Then lastly, the implementation of the tools, of the training and the advocacy tools through using the developed tools, that is as we are going to see as we continue forward. Thank you. Next, what questions did we ask? Next, we looked at defining who a social worker is to these different various groups, what services are received from social workers and what support is missing. Are there unique needs of these particular groups? What skills, attitudes, and knowledge do social workers need to effectively support those that are having care experience? Thinking about skills and attitudes and knowledge were identified as important things. So what are the social workers doing well and what support is missing? What are some of the strengths? What are some of the gaps that are existing in the system as a whole, and how do these particular responses differ from the different groups that we are consulting from. Thank you. Next. Who we talked to? We talked to caregivers, both male and female. We talked to caregivers, male and female. We talked to boys and girls in reintegrated families and also vulnerable families. And a total of 133 people were able to be consulted from. Next. The first approach we used was a helping hand, and it explored who supports my family. As we see in the helping hand, we had to ask the participants to draw around their hands, and then they write for us the different kind of people that support them. And of course, some of the responses resolved around family, social workers, teachers, as we're going to see forward. Thank you so much. We can continue. If you're looking at this particular graph, these were the responses from the people that we consulted from. Highly, as we see the bar up, most people highlighted non-governmental organizations. Of course, there are people behind these non-government organizations. Then secondly, social workers, family members, parents, caregivers, faith leaders, pastors, care home staff. Remember, we have people with lived experience of care. Friends, partners, community leaders, politicians, teachers, God, employers, donors, and sponsors as the list cited ones. Thank you so much. Continue. Through this participatory assessment, we worked with the definition for Global Social Service Workforce Alliance that looks at defining the social service workforce as a broad range area of government and non-government, paid or unpaid, professionals and paraprofessionals who work with vulnerable children, youth, adults, older persons, among other people, to ensure health development and well-being. As we see down here, the social service workforce, of course, as we know, constitutes a broad array of practitioners, researchers, managers, educators. But for this particular participatory assessment, we looked at those particular social workers or the social service workforce in relation to providing family care in line with family care or family support. Thank you so much. Next. When we tried to ask the different people who are social workers, of course, different people had different responses on who a social worker is. One of the quotes that we got was someone working on behalf of an organization, or the person who works in the field, who is like a messenger for the organization. They go into the field, do research, and take back the information to the organization with the aim of helping. And someone said, a social worker is someone as a mediator or a go-between between the community and the organization. Next. Who supports a family? Here we explored what roles social workers play, and we used case scenarios which we used to generate and that informed discussions for different participants to reflect on their experiences. As we look at this particular poster or handout, whatever that is bigger shows the most cited form of support. The bigger the word, the more responses it had, and the smaller the word, the lesser response it had. And you see across all the groups we consulted, from the caregivers, the children, and the caregivers, a lot of support was highlighted was material, financial, and livelihood, guidance and life skills, referrals to other organizations, emotional support, help with schooling or vocational training, general follow-up or monitoring, access to family or friend support networks, protection from abuse and neglect, as some of the support that was provided by the social service workforce or social workers. Thank you. Next. With the key findings, as we've reflected on the other poster previously shown, overall material support looked at increasing household incomes, And as one said, for a social worker should start something for the family, initiating a program for us to be able to meet our basic needs, for example, a business or something like that that is tangible for them to earn money. And someone reflected, for me at our house had fallen down and a social worker came and helped us to rebuild the house. The second support looked at was schooling and vocational training, and this was more looking at providing school fees, books, uniforms, and other form of material support. And for caregivers who are young people, who are youths, they referenced more practical vocational training so that they could be able to earn, to get a skill and be able to earn a living. Thank you so much. The third support highlighted was for children and young adult caregivers. One support that was highlighted was adjusting to life in the community for those living residential care. And this support had to be structured. And this guidance or adjusting to life in the community looked at caregivers needing help to learn how to do simple household chores, acknowledging that some caregivers who are in their children's homes are not able to do anything. Most of the things that are done for them. So as they're heading back to community, they requested, or the support that they got from social workers was helping them to learn how to do some of these particular things. Then relationships with other family members. Remember, you've spent 20 to 25 years in a children's home, and you're going back to meet this family that you never related with. Another kind of guidance looked at discipline and moral guidance, learning right from wrong, listening to elders, not mixing with bad peers, and also finding work or choices in relation to their education. Someone said, while we're growing up in care, we have a routine. We wake up, we shower, we eat, we shower, we sleep. We do not learn anything. The life they give us is a rich life, a privileged life, which is not forever. I think they should train us in real life experiences, you know, and they shouldn't spoon feed us. And for parents, guidance looked at highlighting parents on the importance of children remaining within families to prevent separation, and also helping families to deal with challenging family dynamics, because we realize one of the push factors for children leaving families are destabilized families or destabilized dynamics of the families they are existing in. So one responder said that our parents used to spend money on unnecessary things, and they had no mind of investing in children, and investing in children was like a waste of money. So our parents would have been educated on the importance of children, and also children being in families rather than being taken to institutions. Thank you. Next. Another kind of support was on follow-up, and this referred to checking in with or monitoring children, caregivers, and families in relation to their aspects of, in relation to their well-being, or in case you've given them a livelihood program or an income generating activity, you follow up and see how this particular business is doing, whether the children are faring well, are reintegrating very well in the families. And as we see, one of the responses said, one of the respondents said, we spend a lot of time in orphanages with social workers, and even though we return to our families, we are often more accustomed to them than to our families. It is important that they continue to provide counseling and support. Even if they can't offer material assistance, ongoing counseling and follow-up are essential for helping us adjust and succeed. And this meant a lot more to young people with lived experience of care for this particular support. And another kind of support was on emotional support. Participants looked at social workers providing the an avenue for listening to them, calming them down, helping them think rationally, reduce stress, and also the pressures they may be under. Some of these particular children, when they go to care, they miss their parents, they miss the friends they've been with or the life they're used to, and now they have a different perspective or a different environment. So social workers are very crucial to helping them adjust to the new environment, and also allowing the parents, also the other side at home, to be able to settle down and counsel them because they don't know how their children are doing wherever they are. So emotional support looked at something like that, guiding them, counseling them, and calming them down. Thank you so much. Next. We try to look at the continuum of care versus the role of a social worker, and looking at preventing family separation, material and livelihood support, and helping with school fees was very crucial. Educating and counseling parents on the importance of children growing up in families, referrals to other organizations for services and support. And if we looked at, when we look at supporting children in residential care and their families, helping children to adjust to their life in residential care, including support for making new friends so that they feel less lonely, providing emotional support to children who are missing their family and friends back at home, who may be worrying about those that they left behind. Children whose siblings are still living with parents may also feel discriminated against. I think some caregivers highlighted, when you give away a child to go to an institution, the children that you leave behind feel again discriminated against. Why are they leaving me, and why are they taking so and so? So being able to provide such support to these particular children that are remaining behind, so that they don't feel it's their problem for not going. And then supporting reintegration back to families. We looked at life skills training and guidance on relationships to prepare children and young people for living in the community, and also the relationships that to form with family, friends, and also romantic relationships. Persuading parents or caregivers that children should remain in their families, and assessing families to ensure that they are safe and ready and able to take care of children. So this support looked at different stages, what role a social worker should do or should play in regard to this particular aspect of family care or support. Thank you so much. Next. And part 2, we looked at the skills, knowledge, attitude, and behavior of a good and a bad social worker. A point of reminder, when we asked the particular people or the particular categories we interviewed, a social worker, for them, we asked them these questions depending on someone who supported them. Mainly, it could be someone who is a social worker per se, professionally, but we broadened our cast into the different people. For example, if you're asking young people with lived experience of care, we looked at those particular people that supported them in the children homes where they used to stay. And for community or caregivers, we looked at those different particular people that came in case when time was hard and they supported them. So looking broadly to what a social service workforce or a social service worker is, the responses do not zero down to only professional social workers, but also paraprofessionals. Thank you so much. You next. And we had two ways of getting responses for this particular aspect. One, we used the smiling face and the happy face. And the smiling face looked at a good social worker, and a sad face looked at a bad social worker. And we also used a body map, as we see this particular illustration here. One of the participants, through the focus group discussions, one had to lay down, prostrate down. Then we traced them. They traced them, the participants themselves come up with an image such as this. And then we use the different body parts to reflect in case a social worker is good. If it's a mouth, what are those particular words that they should say to you? In case if it's the hands, what are those different actions that show that this social worker is good? If it's the feet, where do we find this particular social worker? If it's the heart, how does this social worker make you feel? Something like that, to explore those different responses. Next. What makes a good social worker? And also, as we reflected on the other one, this, whatever that is big, is something that was very crucial to this particular group. And the biggest was empathy and kindness, encouragement and hope, someone who acts with humility and is not arrogant, someone who is honest and reliable, available and comes to us, we shall explore more these particular attributes as we continue along. But whatever that you see bigger is something that meant very much to these particular people that we asked. It's something that meant much to the caregivers, to children, and the young people with lived experience of care. And we had to categorize them into 3 categories: personal attributes and attitudes, effective and operates with integrity, participation in community. Thank you. Next. Yeah, as I talked, personal attributes and attitudes took a bigger percentage, and it's a point for us to reflect how do we be intentional as whichever capacity we are in, to reflect on such particular avenues in hiring processes, or even having people around, or as we work with these particular categories of people, how best do we emphasize these particular things? Personal attributes and attitudes, effective and operates with integrity, participation and connection to the community, rather than looking at broadly experience. Empathy and kindness looked at someone who seeks to understand problems and wanting best for others. And they highlighted someone as a bad social worker talks to you with no empathy at all. They make you feel like this is your fault. And then someone who is being polite and not angry, being calm, not getting annoyed quickly, not losing their temper, or someone who is shouting at you. Someone who is friendly and positive. A good social work should make you her friend and bring you close, and shows you be able to open up to them. That is a female caregiver from a vulnerable family. And a social worker is a good social worker is someone who acts with humility, not superior, arrogant, or judgmental. A bad social worker makes you feel like they're doing you a favor, a very big one, and they keep reminding you that they are the ones helping you. Thank you. Hugh. Next. Being effective and operative with integrity, the first thing that everyone said, whether children or caregivers or care-leavers, was someone not being corrupt. And corruption looked at different forms: someone keeping goods that were supposed to be yours, or someone takes a proportion of what was supposed to be yours and they give you less, or asking for payment for services which were supposed to be free. Just we see a quote there. Being effective and operating with integrity meant maintaining confidentiality, not sharing information with other people, not gossiping about them. Someone being honest and reliable, does what they say and they are going to do. And one girl from an integrated family said, social workers have this habit of treating us differently when they are visitors. When they are visitors, they pretend to be nice to you when they are not. Treating people equally and fairly. This came strongly for young people with lived experience of care and children in integrated families, that many social workers or many of the people that supported them had favorites. Just as we see a quote there, they have favoritism. Even when we're in the home, there are those children that were treated nicely and there are those ones that were not treated nicely. And for caregivers in the community, they looked at a social worker coming in the community and being able, in case a program comes up, being able to support their friends first before they support you who is not their friend. Not being violent or exploitative. Children and caregivers who had been in residential care spoke of social workers beating them or making them carry out chores or heavy lifting, something like that. And having a strong or moral compass. They looked at someone believing in God as something that was really crucial. In case they have problems, being able to revert them back to God or to a higher power. It was one of the attributes that they identified for a social worker. And then someone who is easy to identify as a social worker, because we realized most caregivers said many people come in the community and they come and they support you, but some of them are not social workers. You can't know who is a social worker, who is not a social worker. Next. Participation and connection to the community. This looked at someone being available, easy to contact, comes to the community. They looked at the social worker finding people in the community, not them coming to find you, but you going to find them so that you're able to know the different circumstances they're living in and being able to understand really their problems other than them coming to you. And they said, one of women in a vulnerable family said, a good social worker should visit the family and get to know the problems you're facing and get back and get support and gives it to you. Another attribute looked at consulting and listens carefully. This was really crucial for each and every group. Social workers being good listeners and being attentive. One person referenced, well, giving advice. One caregiver said, being a good listener, giving advice and not making decisions for us. They may need to make decisions for children, but not for someone who's over 18. They just need to guide them, not to make their decisions. Of course, we acknowledge these are different age groups. So a social worker, in case you're coming to support young people, you come in to guide, but not to do everything for someone. And they thought that was taking away their power. Another attribute looked at someone who takes time to build trust and understand the community. Of course, we acknowledge all of us that before someone opens up to you, you have to first, build rapport with them. So this is something that they found crucial for social workers. And someone who takes action. I mean, I want us to even think about this quote. Someone said, instead of being in office with the heads of orphanage, they should give us time one-on-one with a social worker in privacy. So if people who are here and you manage homes, I think it's something that we need to really think about, see how best we can have one-on-one sessions with these particular children or young people. Next. Through all the consultations that we had, and the responses from the caregivers and children, and also the training we had with social workers and community volunteers, we made these particular recommendations: the role and functions of social workers as expressed in policies, job descriptions, actual roles they play, because we realized the support that children, caregivers, and caregivers need is material support, livelihood support. But if you're to reflect back, how are social workers trained to fulfill some of these roles that these particular people or this particular category expects from them? Then care reform processes, social workers should be able to contribute to this for the success. I mean, it should be a holistic process for social workers, young people with lived experience of care, different stakeholders, to bring to space the different experience. Then training, supervision, and other capacity building for social workers. Of course, when we had the training for social workers, most of them talked of having a workload or even not having refresher trainings. And they suggested maybe having these ongoing refresher trainings to be able, to understand these particular dimensions of work and how best they can support young people with lived experience of care. Regulation and monitoring of social workers. As we see in the communities, not everyone who comes to help or support a family is a social worker. So maybe looking forward to how best we can regulate and monitor the workforce. Then resource allocation for social workers and the support that they need to fulfill these functions. Of course, the expectations are high from the communities and the young people and the children, but then also the resources are also minimal. So how best do we utilize the minimal resources that we have? Then we also recommended to having linkages to different sectors, especially education and social protection, in having all these particular holistic avenues. Thank you so much. This is it. Thank you. The next phase we had, we looked at developing tools. And these particular tools were informed by the responses from the consultations from the caregivers, and children. We were able to develop a facilitator manual. My team will put the links in the group chat to be able to access these particular tools. Then we also developed a poster that highlights, as we see, how should social workers help me and my family. Then tool 2, a handout, what makes a good social worker, that is accompanied with a video. And tool 3 are case studies of Edith and Eric. These are very beautiful tools that we can use, and we used for 30 particular social workers and community volunteers to reflect on. Next. After developing those particular tools we've seen in the previous slide, we had to test them, training the social workers, both government and non-government, and also community volunteers. And reflecting on the roles that were highlighted from the community, from the caregivers and caregivers and children, social workers responded to, yes, they acknowledge these roles. Yes, most of them, they would fulfill them, but of course there are challenges. And they also gave us some of the recommendations for them to be able to fulfill those roles. And one was looking at building capacity of social workers to handle sexual violence, counseling, and how to handle children, young people, and caregivers with lived experience. Because you have to understand, not many social workers have lived experience. And for you to be able to support this particular category of group, you ought to be having knowledge on how best or what this particular experience looks like. And amid this, in light with having no one or a few social workers with lived experience, they called for a training in how to support or what this looks like for them in case they're supporting these particular people. Refresher trainings for social workers, collaboration with police to support in cases of violence, remuneration and motivation for community volunteers and social workers. Of course, we have to acknowledge globally or even countrywide, somehow the pay or the remuneration for social workers is a bit low. So, and even for community volunteers, of course, their role is voluntary, but they also requested for motivation, for example, having these particular gears they need as they are going into communities, and being able to have limits on airtime or something like that to be able to follow up here and there, or a transport to take a child to a hospital or a police. Then follow-ups for care experienced people after leaving care. That was really crucial. And one social worker from a children's home responded, it is something that they highlighted that they need to do because they realized many young people responded to spending a lot of time with these people, and after leaving them, they just give them 2 or 3 months and then they leave them on their own. So they reflected on being intentional about follow-ups and ongoing support or monitoring. Then the need for children.
Maya, we have about 1 minute remaining, if that's okay. We need to wrap up.
To instill in. Okay. Training for community volunteers on how to support reintegrated families and community participation, on how best they can reintegrate these children and young people back into families. They needed capacity on how best to do that. Thank you so much. Over to you, Hugh.
Thank you. Thank you very much, Sumaya. And sorry to rush you a bit there towards the end. That was an amazing presentation and you covered a huge amount. And it really brings home the reason why we wanted this project to happen in the first place, because here globally at the Global Social Service Workforce Alliance, we've been working for many years with governments, with UNICEF and other UN agencies in far too much of a top-down way, by which I mean we talk about developing laws and policies, and then we recruit the workforce, we promote recruiting workforce and training them as if that's enough. You just train them in the laws and the policies and that goes into their head. But that doesn't translate necessarily into good practice for young people, children and families. And so the big gap in all we'd been doing for several years was we hadn't actually talked to the children, the young people and the families, what they feel like when they are receiving help from a social worker or somebody who is not called a social worker, but is providing social services. So we didn't have that knowledge. Now we're getting that knowledge, and we're really enriched by the knowledge coming from the young people in Uganda, as well as India and Brazil, who have experience of being in state care or in a NGO-run children's home or in foster care, and have experience of receiving social work support in their family or in reintegration. So it's wonderful, and it really brings home the importance that our social service workforce need not just technical knowledge, they need to have those personal attributes which the young people really brought home. They need to have that commitment and those good values and morals that were talked about. And they also need to be able to listen. I think number one seems really important. They need number two, they have to visit. And then number three, they have to do the action, the follow-up. And I think our young people and families expect that. Really listen, really get out into the community, meet with us, and really follow up and do the things that you promised to do, as well as many other things that were highlighted. But those are my takeaways from an amazing presentation. Thank you so much, Sumaya. So now I continue to urge you all. I can see some wonderful comments in the chat. If you have a question, because I can't read all the points in the chat at the same time. If you have a question, I strongly urge you to put it into the Q&A. I can also see somebody with their hand raised. We can't go to the questions right now. So if you have a question, if you have your hand up for a reason, put it in the Q&A, please. You just click on Q&A button where there's a question mark inside a box. There's one question in there right now. So we'd like to see at least 10 questions. Please go and put your questions in the Q&A box, and we'll answer them later. Either Sumaya or other panelists will answer your question. So now I'm delighted to introduce the first of our panelists, who is Dr. Luangula Ronald. Dr. Ronald Luangula from Makerere University, which I have known for some years is a real center of excellence in the training and education of social workers in Uganda. So Dr. Ronald, are you able to open your mic and your video? Okay, we can see you there. Okay.
Yes, I'm able.
Welcome. Okay, so I've said a little bit about you, but maybe you'd like to say a little bit more about yourself by way of introduction, and then I have a couple of questions for you. But over to you, Dr. Ronald.
Thank you very much. As mentioned, my name is Ronald Luangula. I work with Makerere University Department of Social Work and Social Administration, and I'm a social worker by training and by practice. I'm so much enthusiastic about social work with children and youth, and so getting to be part of this webinar, I'm very, very delighted, because then I'm speak or to be part of a subject that I'm very, very motivated to contribute towards. Thank you very much.
Thank you so much, Dr. Ronald. And I wonder if you could first tell us about how social workers in Uganda are currently trained to fulfill the roles highlighted in the findings. So we saw a lot about what young people and families expect of social workers. So how currently are social workers trained so that they can actually fulfill those roles?
I'd like to go back to part of the work that the Global Social Work Service Workforce supported us as a country, working with some of our experts here in the country, Professor Janestic and the Minister of Gender, to develop the competence framework. And I want to say that some of the institutions that I identify with quite much have been able to take up some of the competences that should be an end goal for our social worker trainees. So we trained them towards acquiring these competences. And based on that, and also other curriculum reviews that we have experienced in the country, I want to mention that the way we train social workers, and they are really supported, they are empowered to gain the competences necessary to perform a number of roles that we've been hearing about, that this study has unearthed, roles to do with the provision of family care and support, research, mediation, and building linkages, offering family support, and so on. So what do we do exactly? I will speak about, for example, part of our social work curriculum. One of the core courses that we teach is social work with the children, where we talk much about child protection, and in particular, one of the areas we cover is alternative care. We prepare our students to appreciate that a number of children, whereas they should be able to grow and develop within families, for some reason they are not able to, and they end up in other settings, outside the family environment. Some outside the family and not in a family, so they're in institutions, while others are on the streets. So we help them to appreciate that. And then we talk about, preventing, since we acknowledge that the family is the best place for the children to grow, to thrive, to develop, then we need to do all it takes to see that we prevent the unnecessary separation of children from their families. Many times we think about poverty as a factor but then we say when they get out of the family, where they are going, they're not going to work, and therefore the poverty will remain. Then if you are to support these children to address the poverty, then you target the family as a unit. So these are the discussions that we talk about. We talk about the continuum of care, and particularly when we speak about children and child protection, we are quite emphatic about the principles of child protection. And I will speak about just a few. We speak about, the family as the best place for children. We speak about, as the students get out to work, they should always bear in mind that all actions, all decisions they will be taking on behalf of these vulnerable souls, they need to be in the best interest of the child and not in the best interest of them as professionals. We talk about the possibility that the actions, the behaviors of social workers can constitute the risk of harm. So as social workers, they are trying to be self-aware and aware to the fact that they can do harm to the children consciously, but also unconsciously. And most interestingly, we talk about build their capacity to appreciate the legal framework, both the international, the regional, and the national framework on protecting children, and more so on having children grow up in families, having families strengthened, and if they are out of the family, doing all it takes so that the children bounce back into safe and secure families. And of course, we support them in case management. And one thing I will talk about in the interest of time is internship. One thing that social work does is internship. We really have a strong internship program where students are given the opportunity to work with agencies, with organizations that are in this area, such that they are able to blend theory and practice, to appreciate what we talk about in class and how it applies in the practical world out there. And we are also able to get the feedback of the agency supervisors. In other cases, increasingly, teaching institutions have moved beyond even just the block placement to have what we could call concurrent, that a student is in class 3 days a week and is in the field 2 days a week, such that we are able to listen to what the student is learning, but also to provide real-time feedback to what they are learning. So in a nutshell, I can say that, yes, that's where we are. That's how we are positioning our students to be able to appreciate the roles they should be performing, but also to build the competence to fit and fill those roles that they should be performing. Thank you.
Thank you so much. I'm so glad you mentioned the internships at the end there, because I think that is so crucial to building overall competencies, not just that knowledge, the theory, which is what you will get in the classroom, but also the practical skills and that personal commitment and motivation. And I certainly, when I was a social work student, I think about 80% of what I then carried into my career was very much based from my practice placements and the way that I was then able to link that with the learning I was getting in college. And also the fact that I was observed and I got feedback, like you mentioned. It's a bit like a driving test. I actually failed my driving test the first time, and I think it made me a better driver, because once you've made mistakes and you've had feedback on those mistakes, you really learn and remember. And so I think it's the same, although thankfully I didn't fail my student placements. I know some of my fellow students did fail the placement and they retook it. And that also helped them learn. So it's the ability to learn from mistakes as well as successes and get feedback from your supervisor. But I think in many countries now, student social workers also get feedback from their clients, from their beneficiaries. so that you get that 360-degree feedback about how you perform in practice, which is so important for all professions, including social work. So that's wonderful to hear. Thank you so much. I just have one more question for you, if there's time, before we move on to our next panelist, which is about this very interesting area of social protection and social care. And so if you recall at the very beginning, I mentioned that Uganda has already developed a national framework for social service workforce strengthening, but it already had also an operational framework for social protection and care services. But there is a slight difference between, well, quite a big difference between social protection, which includes the sort of the cash transfers and the entitlement to things like pensions or social insurance and other forms of help, which is provided to thousands, if not millions, of the citizens to lift them out of poverty and help them to become more self-reliant. But then you also have social care, which is much more intensive for certain individuals, as you mentioned at the beginning, who might perhaps can't live in their own family, need protection, or go into alternative care. So I don't know if you could have any reflection on these two roles and these two types of work, comparing social protection with social care, as highlighted in the findings of this particular report. How can we empower social workers in order to work in line with both perspectives? Just to give any thoughts on that. Is it possible for them to do both, or should they focus on one, but also help connections with the other? What do you think?
It is not possible to say that social workers can focus on one. I would like to look at social protection in the broad sense. When we think about our country, Uganda, which I will take as a case study. Of course, social protection in different countries takes different perspectives. But for the case of Uganda, we live in a country where there are a number of social protection programs, but the way they are designed leaves many people vulnerable. I would like to say, you gave an example of the social grant, social protection programs that take a social grant model. A number of them, when you think about this, we have, for example, the senior citizens grant, but it targets the elderly who are aged 80 years plus. But how many are these? If retirement, if I take a case of public service, is attained at age 60, but then the social assistance grant for empowerment, the senior citizens grant, is only effective at the age of 80. What happens within these 20 years, even if somebody was working but has retired? So there is a gap. And for social workers, these are things we should be looking into. Does it mean these 20 years don't matter? Oh, but that's even for people who had the chance to work in formal employment. What about those who were not working in formal employment and they maybe had some work, but at the age of 60, they are normal, age 65, they are normal in terms of energy, age sets in as a social protection risk. And so they need the formal social protection support. But what is available to them comes as late as age 80. So for me, that's a matter of concern, just taking that as a case. Where I'm coming from, I would like to say that social workers need to embrace the policy direction when we talk about social protection. We train ourselves, for example, to be critical of the policies that we have. We have the social protection policy of 2015, and then we have the different social protection programs that we have today. But how effective are they in meeting the needs of the targeted beneficiaries? So for me, for any social worker in the country should be able to interrogate these social protection, the social protection policy itself and the social protection programs in view of the needs of families that are struggling, to the extent that some of the families end up losing grip on their children and the children drop out because they are vulnerable, because the social protection programs are not able to make a meaning to them. They are a drop in an ocean as far as their needs are concerned. That's if they even access these programs. So that's where we are. I think the social workers need to rethink the whole social protection model for the country. It makes more sense for the people.
Hello, Dr. Ronald.
Sorry, I think, can I be heard now?
Yes, yes. If you could just conclude your sentence, and we need to move on. But thank you. Yeah, just finish your sentence, please, Dr. Ronald. Thank you. Sorry.
Yes. So once we have meaningful social protection policies and programs, then the interventions that would underpin these programs, the specific interventions would be able to make a difference in terms of vulnerable families and set the caregivers as well who are seeking, say, independent living to have an opportunity to benefit from social care programs, because a robust social protection program will be able to provide for social care services for these vulnerable families, including the caregivers. Thank you very much.
Okay. Thank you so much. And it's really interesting to hear how the social workers need to think holistically. They need to think about both cash and material support, as well as the emotional, psychosocial support and protection that they provide. And all of that is vital if we're going to prevent children from losing family care. And also so that they can have safe and lasting family care if they're reintegrated with their family. We have to link them up with the wider social protection systems. And as you say, critically think about those. We say that social service workers work at the micro level, which is the cases they hold, the mezzo level across the community, and macro, which is the policy level, the national level. And as you've mentioned, they need to think about and reflect on all those things, as they will do during their career. Thank you so much. So I'd love to move on now. I'm very pleased to see we've got up to 9 questions in the Q&A box. So I urge our panelists, if you have time, and our colleagues from Child's Eye Foundation, if you have a question, you can see the question in the Q&A box that you could answer right away in writing. Just type your answer in there, and then some of the questions can be answered in writing. If anybody has put a question in the chat, I'm sorry, we won't be able to answer any question in the chat, because the chat is for saying hello and introducing yourself. Please, if you have a question, please put it into the Q&A box. That's where we can see the questions, and we'll count them off, answered one by one. Thank you so much to those who are putting questions. Please now move them into the Q&A. Thank you for those who've done that already. Now I will turn to our next speaker, who is our panelist, Dr. Moses Senkose from the National Association of Social Workers in Uganda. I'll go straight into your first question, if that's all right, Dr. Moses, but I also will give you a chance to say a little bit about yourself as you answer that question. So we'd love to hear a little bit about yourself and the association. We understand that the association is the umbrella network of all social workers in Uganda. So we're wondering how your association, NASWU, can be supported to regulate the practice of social workers in their actual service delivery. So maybe you could explain about yourself and the role of the association in regulation and supporting practice. Yeah, thank you. Over to you. Yeah, Dr. Moses.
Thank you, Hugh, and good afternoon. As you have said, I'm Badia Senkose Moses, and currently the president of National Association of Social Workers of Uganda. And I'm glad to be here, and I'm glad to listen and watch the presentation by Child's Eye, because it really focuses on social work, and it's interesting, and the findings really, I mean, if we take them up, they will contribute to the strengthening of the social work profession in Uganda. Thank you, Dr. Ronald Luwangula. I also teach at the university, so yeah, those answers were really interesting, and yeah, they give a foundation to what the question that have been asked. How can the NASU, or National Association of Social Workers of Uganda, be supported? Yes, it is an umbrella organization for all social workers, but because social work as a profession is not regulated in Uganda, we can say it's an umbrella organization for a few social workers. There are really very few social workers who are active members of the association. This year we had the annual general assembly, and I think in terms of the attendance, were not more than maybe 150 members who attended. But I remember when I was doing my undergraduate social work degree at Makerere, were around 120, I think 120 in the class. So you ask yourself, and I mean, it's not only Makerere which is training social workers. There are other universities, many universities in Uganda training social workers, but these social workers are not members or active members of the association. So the association needs to be supported. And how can it be supported? I think one thing that we need, if we get a social work council to regulate social workers, okay? So I want to imagine that the social workers, the professional social workers, will see the need of being members of the association. But right now, because the profession is not regulated, they don't see the need. And I know when Sumaya was presenting, she was talking about who a body social work is, and then the issues of the skills and the values. And I know Dr. Ronald has come. Actually, all these things, the knowledge, the values, and the skills are taught to the social workers. So we are taught these things and we know them, but anything which is not protected, which is not regulated, definitely abuse is inevitable, okay? So definitely people can choose not to exercise integrity, and because I know they can go with it. So so that's where we are. So that you have social workers, trained professional social workers, and they do things that are not ethical, but they know nothing really is going to happen to them. They will continue practicing, but also because there's no regulation, you also have people who are not social workers, who are not professional social workers, who are actually practicing as social workers. So even when you are talking about the skill gap and or the abuse, it may be, yes, from two sides, both from those who are trained, but also those who are not trained, because it's not regulated. So we need to be supported really by the government. I know right now we wrote an MOE, Memorandum of Understanding, which we have given to the Minister of Gender, Labor and Social Development, so that we can see how we can work together. And in there, one of the things we are asking the ministry is to actually draft a bill, the Social Work Act, okay, to take it to Parliament, so that the profession is regulated, so that a social work or people who are involved in the social service practice are known, they are defined, okay, so that we don't have everybody, whoever is helping, says, I'm a social worker, and then they abuse. So that's one thing we need to see that we are supported, but then also the agencies, and I want to really thank the Child's Eye, and there are others, a few others, that actually really act as like gatekeepers when they are recruiting, okay? Yes, they may not really depend or rely on the association, but they look out, okay? They recruit people who are professionally trained, okay? So that they don't just get anyone, whoever claims to be a social worker, to come, and then they are given positions of social workers. So I think there are some of those organizations. I know, yes, Child Eye, I know Uganda Christian University, UCU, used also for you to be given a position at UCU as a lecturer, you needed to show evidence that you're actually a member of the association. Okay, so that way, actually, they are supporting us. So I think social agencies, social work service or agencies, they need to, if they do that, okay, then they will make actually the association stronger, and then the association can actually be involved in regulating the practice of social work in Uganda.
Okay, thank you so much. And you've actually already answered my other question, which was about collaboration with government and other agencies like universities. So you've spoken about that as well. So thank you so much. You covered that. You've actually also answered some of the questions that I've seen coming up. There have been questions about the law in Uganda. And as I understand it, you also recognize the need for a law to regulate social work, and you're advocating for that right now. But there is not yet a draft law before Parliament, is there? There is.
No.
There's talks about drafting one. Okay, thank you so much. So at this point, I'd like us to all turn to the Q&A box. I'm sorry that I'm being so assistant, but if anybody is still writing a question into the webinar chat, we will not be able to answer it there because of lack of time. We will all turn our attention to the Q&A box, and if you have a question, please put it there. I'm very grateful that some questions have already been answered in writing. So those of you who've seen your question answered, I hope that is satisfactory. So I'm just going to the questions that remain open for now and see if we can find someone to answer those questions. We have a question from Christopher Mwanguzi. How can we best ensure, this is to Samaya, how can we best ensure that your findings are shared with our government in partnership with you to strengthen social work practice? Additionally, do you feel there are other key stakeholders that should be included? So Sumaya, are you able to answer the question about how findings will be shared with government and then others that could be included?
Thank you so much, Hugh. I think we can have engagement meetings with our government, showcasing the findings with different departments in Ministry of Gender, Labour and Social Development, and also the different departments working with children and youth to make sure these findings are utilized and see how best they can inform practice and policies therein. And then the key stakeholders we can think of to work with, first, the National Association of Social Workers in Uganda, then the different universities existing, International Federation of Social Workers, other NGOs and international NGOs like Save the Children, UNICEF, to be able to have these particular concerted efforts, and other NGOs like and other alliances, for example, the Global Social Service Workforce Alliance and other alliances coming together. Those are some of the stakeholders I'm thinking of, and also the associations of caregivers in Uganda and also associations of caregivers worldwide. Thank you.
Thank you, Samaya. And could I urge all the panelists to put your videos back on so that you're more ready to be seen when you're answering questions, if that's possible. Thank you. So we have a question from Kelly Strong. In the context of Kakamega County in Kenya, I'd love to learn how you foster a healthy and inclusive culture within your local social workforce team. Especially, how do you address the use of language and approaches that may unintentionally harm or alienate the young people and care leavers that you serve? For instance, many care leavers and young people have shared that they often feel social workers are not always genuine. Sometimes they're operating with personal agendas or even a savior complex. How do you, oops, the rest of the question was cut off, but maybe Sumaya, would you be able to speak to that one? Or if not, yeah, go ahead.
Thank you so much. Just as Dr. Senkosi and Dr. Luangula have said, some of those things come back to personal integrity and personal attributes, because and also operating, because most of these social workers come and support these young people, but they do not have the experience of what it means to be in care. So highlighting that balance between what someone went through and what you're bringing on board, being able to move into those shoes, I think it comes handy with social workers, but I think it also comes with skills and experience of what this particular experience means to these people. I think it's more of upholding those particular attributes and being able to be more of empowering other than, as they said, we reflected on the findings, more of empowering and guiding, other than just bringing things, telling someone, you know, you can do this, you do this, this and this and this, other than giving them to do what you want them to do. It's more soliciting for their opinion and giving them the capacity to think on their own, other than thinking that you know it all, something like that. So being able to give them that avenue, giving them a platform to have their voices, and also being able to articulate exactly what they would want you to do for them, something like that, more of a collaborative relationship other than more of a power over. Thank you.
Thank you. And I can now see the rest of Kelly's question, which I think you've already answered, which is then how do you navigate the dynamics to ensure aligned mission, trust, authenticity, and respect in your team's work? And I think you've answered that already, haven't you, Samaya? That trust building is clearly crucial. People have to act authentically and also professionally. And that is how that they will garner respect. So not working in terms of their personal agenda or their own personal biases or prejudices, but actually as a professional and as a really good listener and empowerer. And you mentioned empowerment as being so important. So thank you, Kelly. I hope you find your question answered. I urge panelists, if you have other comments you want to put in response to the questions, you can type those in. Kelly, I'm afraid we'll move to another person now because we need to balance out the questions. So I'm going to move on to the first question from Sarasupadi Munusami. Were there any political barriers or resistance encountered during the implementation of this project? If so, how were they addressed? I don't know, maybe David, since you're the country director for Child's Eye Foundation, is this one that you could answer? Have you encountered any barriers or resistance in the implementation of this project?
Okay, thank you, Hugh. So we actually incidentally did not encounter any barriers during the implementation of the project. Local government was actually willing to work with us. The Association of Caregivers, also through their networks, did not encounter anything. What we always do is we are always open about what we are going to do, and also just try to enlighten, and highlight the importance of why we are doing this. So we didn't encounter any political barriers.
Okay, that's wonderful to hear. I do remember one issue that came up that Samaya has mentioned in the past, which is not so much a barrier, but maybe a little bit of resistance when social workers found themselves being criticized. And I feel slightly guilty for this concept of the good social worker, bad social worker, because if you remember when we were planning the project, we had rather complicated languages to describe how to get the views of people on the attributes of social workers and how they experience. So we kind of crystallized it and simplified it to say, could young people tell us what they see as examples of good behaviors that they would like to hear and receive from social workers compared to the more negative behaviors that they sometimes see? And that's how we ended up with this contrast between good and bad. We weren't trying to say that those are bad people. We're just saying that those are the kind of negative things that sometimes they might experience that they would wish social workers avoid, and other things they would like them to do more of. But I think that there was a point that some of the social workers felt that the negative criticism was being directed at professional social workers, whereas in fact, I think, as you said, Sumaya, am I right, that the young people had experience of others who are in a more informal capacity, who are not professionals, but people thought they were social workers, and that somewhat lowered the reputation of the overall profession. Is that correct, Sumaya? Do you want to say just briefly something about that, how you had to clarify that issue when you're providing feedback to the social workers?
Thank you so much, Hugh. As we know, many young people stay in the orphanages or children homes or institutions per se, and there's an array of people supporting them. For example, aunties, uncles, people with the school education department, the different people come in different aspects supporting them. And when we're asking questions, we looked at all these particular different people that came in and supported them, those that supported them transitioning from care, and also those that supported them after they left care. So particularly, some of them were not professionals per se, but these are people who supported the processes they were involved in. So generally, it's not, that's why I emphasized these social workers to this particular project meant many things to different people. And we looked at that array of people that supported these particular people or families or children and caregivers in context to family care. Thank you.
Okay. Thank you so much. So we have an additional question, and maybe I would like to turn to Dr. Moses, if that's possible, to answer this question, which is about the majority of graduated social workers. Where are they employed? Do you have any data on employment? Is a majority in government, non-government, or in particular agencies? Do you have data on that?
Thank you, Hugh, very much for that question. We don't have the data as NASU, but what we know is that a majority of the graduates are in the non-government organizations. That's where they are. That's the sector that employs most of the people. Within the government, the public sector, there are few positions for social workers. They are not very many, but most NGOs, as they do community work, they employ most of the social workers. That's where they are. So, but as in NASU, we have not carried out to study to capture them or profile. But the few members that we have, definitely we know, because now we can talk about the members, the registered members of NASU. We know that majority of the registered members of NASU, they are in non-government organizations.
Okay. Okay. So thank you so much for answering also some of the questions in the chat about the role of the professional association. Sorry, the questions in the Q&A. That's very helpful. Indeed, there is, I think, some ambiguity still in Uganda that the government does need social workers, and the professional, the probation and social welfare officers at district level typically are a social worker, but the number of posts are obviously quite limited. And I think there's a big move to try and expand engagement of social workers in government as well as in NGOs. So it's a very interesting field, and I think we should watch that as this develops over time in Uganda. Also, that the ones working at sub-county level as well, supporting the community development officers, I think we also clearly need to have more social workers there as well, alongside the NGOs. I just have one more question before we go to closing remarks, if that's okay. Someone has mentioned something about reintegration and some of the challenges involved. Could you tell us maybe briefly, Samaya, about the challenges that you've faced in actually supporting reunification and reintegration so it's lasting and effective? I think that's probably the only question that we have time for, because I think it seems that others are facing challenges in that area, as well as the challenge of supporting care leavers through vocational training. But if you could start off with the family reintegration, or are you able to answer that? Or perhaps David, I don't know, someone from Child's Eye? Yeah, David.
Okay, I think I can support. Yeah, I think I can support to answer that if I'm getting the context right. So some of the issues that we face with reintegration.
Yeah.
Of course, some of the children and young people had actually lived away from parents or their parents or their relatives for a very long time. So that process of bonding actually takes quite a bit. And it's very difficult and harder for usually teenagers and young people if they've lived away from their parents for a long time. We've seen cases where young people actually don't even want to go back to their biological parents, to their relatives. They actually want to live independently. They've lost all contact. They've lost that bond with their families and want to live alone. Another experience that we have is, of course, now for young people, helping young people to be integrated in the community is quite expensive. That's the learning that we got. This is somebody who has stayed in an institution, in a children's home for a very long time, and you actually need to set them up and ensure that they have support around them for them to actually live independently. So it's something that needs quite resource intensive. You need to ensure that you make a plan with them that is actually going to be very sustainable, and ensure you tag them to community members, to structures within the community that are able to give them that sustainable support that you won't be able to give them after a certain time. And then the next point in terms of supporting care leavers who went through vocational training or get employment, Yes, it's also just trying to reach within your networks to be able to support them to get gainful employment, networks that we will have to map, your map services, you know, some people can be able to take them on. We've had certain young people where we've actually started some businesses for them once they've gone through the training, and then so they're able to actually continue, you know, with the business, and we ensure that they also still tag to mentors and people who can support them through that business journey so that they are able to become sustainable.
Okay, thanks, David. I'm going to turn to you in just 1 minute. I'm very interested that you mentioned that point about one of the challenges in reintegration is if children have spent a long time away from their family, and the longer they have spent outside of their family, the more challenging it can be for them to be reintegrated, which makes me think of one thing that perhaps wasn't mentioned much today, which is contact and supporting safe and beneficial contact for children. And I think that's something that foster carers can do very well if foster carers are trained and ready to do that. But also, if there are children in residential care, they should also have a right to contact visits if it's in their best interest, obviously not harmful, or if it's done in a way that's upsetting. But maintaining contact is like maintaining that bridge. You can't get from one side to the other side if the bridge is not there. The bridge is about contact. It's an emotional bond as well as a physical bond. So I think that all care providers have that responsibility to build towards reintegration from the beginning, which I think answers the other comment about most CCIs fear the family transition process. But maybe the institution wouldn't fear family transition if they supported it from the very beginning, as they saw it. Our job is to provide daily care, but our job is also to prepare children for the return. And to do that, we have to keep them in touch with their families, or at least whichever member of their family or extended family is a positive influence for them and a possible source of care in the future. I'm going to hand back to you now, David, for your closing remarks. We've got some questions that we can't answer, but we covered a great deal today. I thank you to all the panelists, but David, over to you to help us close. Thank you so much.
Okay, thank you, Hugh. And thank you for doing a fantastic job. To our panelists, really thank you, Sumaya, for sharing your work. This has really been a very insightful project. And with the findings that were shared, it just took us back to the basics, you know, of social work. It being a humane profession, a profession just that wants to help, you know. You as a social worker, what is your calling in terms? Have you reflected your practice and how you've been supporting families, you know? Just trying to put yourself in the shoes of the person you're actually trying to support. You know, have you done everything in your power to support them? Have you explored every possible solution? Have you included them within the process? Have you been compassionate, you know, understanding, welcoming, you know, and how have you treated them? Have you treated them fairly? You know, we are supposed to be advocates for the people that we support. If you yourself needed support, how would you want to be treated? I think those are just things I want us to just reflect on as practitioners and take them back to the wider teams that we work with. But thank you, Hugh from Global Social Service Workforce, you and your team, Child Frontiers, Angie, Emily, as well as the Child's Eye team, Sumaya, Evelyn, for really putting this together. And this is something that we are going to keep on disseminating and sharing with whoever we can. I remember there was a question where somebody asked about whether we had done any impact for the training, but yes, we've not yet had the training. We will communicate and let you know once we've done the training and how that looks like. So thank you, everyone, and thank you for supporting this. Back to you, Hugh.
Thanks, David. And for anybody who was wanting to find out about the findings, the link is there in the chat. So please open that link before you close the webinar, so you can go into that link and you can find findings from this study, but also the tools that were generated, which we encourage other people to use and further adapt and test in your context. Because the whole idea of this project is to create waves and where you can continue to do the same and continue to listen and engage with care experienced youth in order to improve the training of social workers, social service workers, and advocate to government for ways that should be done more consistently in future. So it's been a wonderful opportunity for all of us. Thank you so much for all the panelists. Thank you, David, for your wonderful remarks. Sumaya, Dr. Moses and Dr. Ronald as panelists. and to Child's Eye Foundation and the Association of Care Leavers of Uganda. Thank you so much, and all the best to everybody, and wishing you wonderful, happy holidays and a happy new year as well. All the very best. Thank you.